Thank you for coming in today. Tell us your name.
My name is Steve Watkins,
Yeah, and how long have you been a patient, Steve?
about a year.
Okay. And tell us what brought you in originally.
I had issues with digestive, diverticulitis in particular, and blood pressure. And so that's why I came in.
Yeah, those were the main reasons.
Yeah.
Excellent. And how are you doing with those areas now?
Great. I haven't had any kind of flare-up with diverticulitis at all, probably in about 8 months. And my digestive is great. I did the purification. My blood pressure has came down. I even cut my blood pressure medicine from a 40 milligram to a sliver. I don't even know what it is, but I don't even have to take that. So.
Oh, excellent. Okay, great. Yes, you've done very, very well. Yeah, and you followed everything that we recommended, which has been great. You learned a lot about diet. One of the big things that was contributing to some of your inflammation was eating wheat.
Yeah.
Huge. Yeah, and it's obviously something that you could tell when you ate it. You would experience discomfort.
Yeah, my stomach would bloat up, and I didn't know that I was allergic to wheat.
Right.
Until, you
Pointed
did the
it
test
out.
and told me.
Yeah.
So I've eliminated the wheat. I don't know, probably wheat isn't everything, but in a lot of foods, but just what you told me to how I should eat has helped me a lot.
Yeah, absolutely. Yeah, good. Reduce the inflammation, reduce GI issues. Yeah. One of the things we know about wheat allergies is that they're related to cardiovascular issues. And so high blood pressure can be one of those things as well. It can be a contributing factor because it promotes inflammation in the vascular system, which makes sense that your blood pressure would then go up. So many times just by eliminating wheat, that can help with blood pressure.
Yeah.
Which is huge. We had some other things that we were working on, but obviously your diet's a lot better now.
Yes.
You've learned how to eat. We do regular in-bodies in the office, so you learned how to read your in-body and to kind of track your results with the body composition analysis.
Yeah, very important.
Yeah, absolutely. And how did you feel before you started in comparison to now?
Well, before I even came to you, I was lethargic, bloated, and I was scared that I was going to have another flare-up in my stomach, and I didn't want to go to the hospital again.
Yeah, because before you'd been in the hospital to treat it. Okay, yeah, absolutely, yeah. And you wanted to address it long-term.
Yeah, and after you helped me, we did a gut restore on my whole digestive system. I'm good now.
Excellent. Doing awesome. So you're saying you wouldn't go back to the old way of doing things?
No.
Yeah.
No. And just by, being with you, Doctor, is you have taught me how to eat, the right supplements that you have me on is very important.
Yeah. If somebody asked you, would you say this was hard?
No.
Yeah.
No, it's not hard at all. It's a change that you need to make.
Right.
Yeah.
Yeah. It's doable.
Yeah.
Yeah. And it's worth it.
Yeah.
Great. Well, I appreciate you coming in today. I appreciate you telling your story. There's so many people. We've had a number of patients that have come to us with diverticulitis, and we've been helping them in a similar way. You mentioned the gut restoration. That's a big part of it.
Yeah.
Is getting the gut back in balance, bacterial balance, making sure that gut motility is there, making sure that a person has plenty of fiber. Obviously, when you have a flare-up, that can irritate it, but that's huge. But you learned about all that.
I did.
And what we want to do is, like you said, prevent you from having to be reactive by being proactive.
Yeah.
And it's great to have, hospitals and conventional medical doctors that you can go to and when you do need to be reactive, but we want to prevent having to do that.
Right.
Yeah, it's way better to be proactive.
Yeah.
Yeah.
And I refer everybody that is having any type of health issue to you.
Yeah.
And I always will.
We appreciate that.
Yeah.
We appreciate that. We want to help as many people as we can.
Yeah.
And I know you do it because you care about them.
Yeah.
Yeah, absolutely.
Definitely.
Well, great. Well,
Yeah.
thank you for coming in today, Steve, and I really appreciate it. And you've done awesome.
Good deal.
Yeah,
Thank you.
You're a great patient. You deserve all the credit.
Yeah. Thanks.
Thank you.